we're providing $59 million over the next 3 years to upgrade and expand the Rockyview Hospital's intensive care unit, the coronary care unit, and the gastrointestinal clinic. Each year, these units care for many more critically ill patients than the spaces that they were built for years ago. And that's why we're expanding them, to ensure that people and families living in Calgary and the surrounding areas will have better access to top quality intensive care, coronary care for heart problems, and diagnosis and treatment for a host of gastrointestinal issues. We know that as our population ages, more people will need improved access to screening programs for things like colon and lung cancer, and so many Albertans already struggle with Crohn's disease, with inflammatory bowel disease and irritable bowel syndrome, and need access to non-surgical procedures, services, and care. So thanks to a generous contribution from Calgary's Health Foundation, this project will double the size of the Rockyview's gastrointestinal clinic. Regular Albertans stepped forward, dug into their own pockets, and are now partnering with Alberta's government on priority projects like this one at Rockyview that will improve their health and their access to medical services. All told, expanding the ICU, the coronary care unit, and the gastrointestinal clinic at the Rockyview means that thousands more people from Southern Alberta will have access to the care that they need when they need it and where they need it.
And each year, the ICU admits about 275 patients into the 10 beds, providing specialized care for the sickest patients. The coronary care unit, or the CCU, with its 7 beds, is also incredibly busy, caring for close to 540 patients each year who need critical care after a heart attack or after a surgery. Together, the 2 units, for a quarter of the time, care for patients more than their nominal capacity, and they manage occupancy as high as 130%. Now, to be clear, ICUs and other units do sometimes go over 100% at their peak times, and that's not new, but this is too much. It's a problem that needs to be fixed, and we are fixing it. This project will expand the ICU and the CCU to 25 beds, all in single patient rooms, up from the current number of 17. So from 17 to 25 of these beds. And it will move the units into a combined and updated unit that will be a better space for patients and a better space for the staff who work in them.
It's been about 26 years since the last significant upgrade was made to the Rockyview's ICU. Not surprisingly, the dozens of staff and physicians who provide care to the almost 1,100 patients admitted to the ICU and CCU each year are very excited about their future home and what it means for patient care. This investment will increase ICU capacity from 10 to 14 beds and CCU capacity from 7 to 10 beds. Not only are we adding more beds, we're also creating a better, safer experience with larger patient care rooms to support critical life-saving equipment.